there is absolutely no need for me to share any data with you because it's already been shared. But what I will share with you is my name is Frances Mills, and I serve as the Health Commissioner for the Cleveland Department of Public Health. And the work that I do is equity focused and equity centered. And so when we talk about equity, one of the things that I have appreciated about being on this panel is this. Dr. Hall started with providing a history of his own life and the history of this building and what it has meant to this community. Equity centers on those things that take into account the history of what has taken place. And so when we start from a public health perspective, I feel privileged to share with you that public health, even though we're just getting into our stride in terms of equity work, there are certain services and programs that are embedded within health departments that have been equity focused for well over a decade. Before becoming the health commissioner, I served in another role in the health department, and that was called the director of the Cleveland Office of Minority Health. And offices of minority health are funded by an organization, a government organization called the Ohio Commission on Minority Health. Dr. Hall was president of the commission at some point in his tenure. Dr. Motlin was president at some point in his tenure. And they have continued to collectively bring that work locally and outward in the clinical setting and into the community. So I feel privileged always to be with you. And Dr. Motlin, when I first started to work at the health department, I was doing my little workout at Lifetime, and I looked into the spa and I was like, oh, there's Dr. Charles Motlin. I hadn't met him yet. And I walked into and I said, excuse me, are you Dr. Motlin? And we sat down and we're sitting there sweating together. And he said, yes, I am. And I said, well, I'm the newly minted director of the Cleveland Office of Minority Health. And in the space of an hour, he proceeded to tell me about all of the previous directors of the Office of Minority Health, the work that they did, and now what are you going to bring to the table? Dr. Motlin also serves on the advisory committee for our group here in Cleveland. And so when we begin to talk about equity and where we're going, I always start out that, equity makes sure that we value all people. At the end of equity, we're going to ensure that resources are distributed according to need. And that's where equity has sort of come to a screeching halt when we begin to talk about who needs what and how to get it to them. Because it sounds nice to value all people, and it sounds nice to want to ensure that people get to an optimal place of health. But systems have historically blamed people and focused poor outcomes on bad behavior versus where do I live, what's happening in my community, what resources are made available for me, what's the quality of treatment that I get when I do go into care, and are my needs really addressed? And so the Cleveland Office of Minority Health, what we do is we inform and we educate. We go out into the community and we say, hey, did you know Black babies were dying? When I first started doing that in 2015 in the city of Cleveland, I went to Black places, Black spaces. No, we don't know Black babies are dying. Why are they dying? Well, let's talk about this. Do you know? And it's almost, we're so in tune with hearing bad news that when you say, well, African Americans have the highest rates of heart disease and diabetes, and the babies are dying, and people tune out to that when there's no solution offered or no resource to be given. And so people don't know because they tune it out. We live in a community, I don't know who touched on it, 50% of our children and old people live in poverty. If we're talking African proverb, we say how the health of a community is determined by how we treat our young and how we treat our old. And so we know that Cleveland, in spite of all of the things that are happening, good things, we're still miserably failing. If we talk about, we get a report card from the March of Dimes that says, well, Cleveland is a D. If we talk about community violence, where the disparity is 6.7 to 1. If you're an African-American, a male, 15 to 34, you're 6 times more likely to die of a homicide than in any other place. And so the question becomes, well, why is that? Because we do great at citing statistics. Well, the bottom of that is racism. And so public health is getting to a place where if we talk about, anybody in here have a MPH, Masters in Public Health? Anybody? Okay, in public health, you do basically 10 things. You investigate disease, you try to pinpoint what's happening, and you monitor that disease across populations, also called population health. You inform and you educate, you work with folks, you ensure that individuals have access to care, you ensure that care is of a quality nature, you want to make sure that your workforce is competent, and you want to make sure that the services that you provide overall are meeting the needs of the community. Well, when people matriculated into schools of public health, if you went to a public health school prior to 1994, in the center of the public health essential services was research. If we could just research better, we can help more people. Well, we all know how research looks with African-American people and other communities of color. We don't participate in clinical trials at the same rate. And so we're always going to get the same thing that we've always gotten if people don't participate in research opportunities. Well, today in 2020, the American Public Health Association said, instead of research being at the center of that wheel that's the foundation of public health, we've really discovered over the last 25 years, since 1994, that equity is at the center of all things that are going to happen to help improve health across populations in the city. And so it's good to know that there are African-American, there are Latinx, there are Asian clinical practitioners out there who are but it's woefully less than what it should be. If you're talking about physicians, about 5% of physicians nationally are African-American. And then when you begin to talk about specialty services, then that number goes down significantly. When this doctor over here talked about mental health, I mean, I represent the public system. Prior to working at the Department of Public Health, I was an administrator with the county in the behavioral health system. And we talked a lot about and promoted a lot of the evidence-based practices that she talked about. That if a practice is going to be good, it has to be evidence-based and it has to be replicable. You should be able to take that service, that intervention, and use it across many, many different populations. Well, it doesn't work that way if what you're providing does not meet the need of the person that's sitting in your chair or sitting in your office. And so it was being in practice of being an educator by licensure. I'm a prevention educator. We have to have cultural competency. We have to have that training. Your hours are 30 hours, mine are 40. And let me tell you a story. For the first time in 25 years, I have been rejected by the Ohio board because the training that I provided to them in terms of hours was deemed unacceptable. Because the training that I submitted, there was some ethics, there was some things, most of it was equity-centered training, which is the work that I do now, which is not accepted as acceptable hours for renewing your license. And so when we talk about equity, we have to talk about racism. And that has not been a comfortable conversation in this city, in my estimation, as a public administrator over the last 30 years. We are now getting to a place where 10 years ago, I can say this with authenticity, bringing up the issue of race in some rooms was enough to offend the people in that room, and the conversation was ended. You would not be invited back to that meeting. And so when we talk about how services are planned, there's a thing called a community health needs assessment. That is an assessment that is supposed to identify the needs as well as strategies to address issues in the community pertaining to health. I got involved with community health needs assessment work in 2016. And it was a very small subset of people, 25 people in a room, who were movers and shakers in our community. And I looked around and there was 2 Black faces in the room, no Latinx faces in the room, no Asian faces in the room. And so because I am who I am, I'm not a physician. I don't care about, I don't have to impress you. I said, where are all the Black people at? Where are the Latinx people? Where are they? Because there are so many good things happening in this community that are organic and Black led, Latinx led, Asian led, that have the capacity to help us do better in community if we would just partner. If we would partner, not just partner, if we would partner well, let me say that, because hospital systems do things their own way. At the end of the day, hospitals like to say, well, there's no competition. There's competition. If you look at the trajectory, if one hospital does something, pretty soon after, another hospital is going to do it, and the next hospital is going to do it. And so how do we work together in order to advance the health of the community? That's where public health comes in. Public health comes in because hospital systems don't think a whole lot of, our value in the community in terms of what we can do, but it is more likely a place where there are people going out into the community and attending those never-ending health events and health fairs, talking to people. You go to enough health fairs in Cleveland, you'll see the same people there with the same needs. And what happens in behavioral health, I find that the people that I used to see in behavioral health, mental health agencies, alcohol and drug agencies, their families are the people that I see on the public health side. Their families are the ones that come to McCafferty Center or J. Glenn Smith, which is right down the street. And so we have to be able to meet people where they are. We have to be able to commit to a relationship. The challenges that we have in Cleveland are around partnering well and making the commitment to stick, because equity work is long work. There are so many people who say that they are doing equity work, that they've been doing equity work for decades, and they don't even know the meaning of the word because it's long work. This is not going to get solved in 10 years, 20 years, 50 years. As soon as we solve one thing, Prince, we were talking about this, another thing is going to rear its ugly head. And so we have to learn how to partner well, and we have to learn how to get out of that deservedness mindset. Who deserves what services? Everybody deserves good services, good care, competent practitioners. And so the work that we do in public health and the Office of Minority Health, we talk to people. We talk to physicians. We put together little documentaries. We worked on a short film that is now ubiquitous in this community called Toxic, a Black Woman's Story, about infant mortality. That came as a result of talking to people, talking to families who had lost children, and they began to talk about not just losing their child and not having a place to process grief. You know, what happens when people lose children? Well, they send them to Cornerstone. There wasn't enough therapists that were known for people to send folks to. I did a focus group with 700 women in 2017 and asked, how many of you have ever lost a baby? Probably 80% of the room stood up. How many of you ever received any mental health support for that loss? Some women said, we never talked about it again. I lost my baby 25 years ago. There were women there who had multiple miscarriages, never had a place to talk about it. The folks who funded Toxic First Year Cleveland, we were also working on a project to build cohorts of therapists who would do specific grief recovery support for families who had lost children. And so they're on their 6th cohort now, at one of which is at BBC. And so these are the kind of things that happen when you're able to talk to people and respond as a result, because systems are slow. Systems are very, very slow, and oftentimes they're fixed. There's a food movement in the city of Cleveland that's going on with Black urban farmers wanting to help people get fed. Cuyahoga County, 50% of Cuyahoga County is a food desert. So if 50% of Cuyahoga County is a food desert, you know that number increases exponentially in the city of Cleveland. And so people are looking to be fed, and not necessarily always through a food bank. And so how do we help build capacity for individuals who have a product, but they may not have all of the business know-how in order to get that product to production or into people's hands? That's what the health department does. The Office of Minority Health alone has probably 26 or 30 different affiliations of different groups that we work with, all focused on some aspect of improving health. There's groups that are working on how do we improve screening for cancer. We know that if we're talking about breast cancer, lung cancer, prostate cancer, colorectal cancer, clearly in the city of Cleveland, African Americans by far have the highest rates of those cancers, and it can be specified down to a neighborhood. Central has the highest rate of cancer and has had the highest rates of cancer diagnosis in the city of Cleveland. And so we take that data, we talk about that data in different places, and things happen. We become willing to partner with people, all 3 hospitals. It has been a pleasure working with Seidman, working with Taussig, around singularly being focused on improving preventative screening and letting people know that if you have a history of cancer in your family, you can talk to your physician to get screened earlier than the standard, letting people know what the standard is. Same thing with diabetes, same thing with asthma. We have 5 divisions in the public health department. There's a division of health, which that's the division I work in. There's a division of air quality. There's a division of environment. There's a division of administration. And our new division is called the Division of Health Equity and Social Justice, which was established specifically to address disparities that we see occurring in the programs of the services that we offer, but also to look across the entire city into other departments that impact social determinants of health, to say, what is Cleveland's response to addressing social determinants of health, and what is Cleveland's response to eliminating racism? And so 10 years ago, it was very uncomfortable talking about racism. 5 years ago, we began to work on very specific projects to reduce disparities. 4 years ago, because our equity work was not contingent upon what happened with George Floyd, we were able to have our legislators declare racism as a public health crisis. And then in 2021, this new division was established by law, cannot be removed in the health department to specifically address health equity and social justice. So where we've been is trying to throw off the legacy and the history of racism, and where we're going is to improve collaboration, to work from a policy perspective to improve the health of Clevelanders. And I'll end on this note. Be civically active. Be active in your community. Be aware, learn about the policies that are impacting your health in your community. There are two critical policies that are happening in Ohio, right? One in Ohio and one in the city of Cleveland. The first one is House Bill 142, which is getting doula services reimbursed for payment. Talk to your legislator, talk to your council people, support that legislation. In the city of Cleveland, there's legislation that was heard in February around establishing a tobacco retail license in the city of Cleveland, which would require people who sell, organizations that sell tobacco, that they would have to pay a licensing fee that would be used to provide tobacco cessation education in the city of Cleveland. And then the second piece of that legislation is eliminating flavored tobacco, including menthol, which is very controversial. And people are saying, we don't want this because it's going to put our small businesses out of business. But if you look at your corner stores that sell, what are their primary things that they sell? They sell tobacco and they sell alcohol. And so people are really going to have to decide, what is it that we value for the health of our community? So I'll stop right there.